Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And today's guest is one that came recommended from the Healthcare IT Today community, so I'm excited to learn more about her. She's Naomi Lenane. She's CIO and VP of Information Services at Dana-Farber Cancer Institute. Welcome, Naomi.
Thanks for having me, John. I'm excited to be here.
Yeah, well, I think you have such a unique perspective, so I'm excited to dive into some of that. But before we go there, tell us a little bit about yourself and Dana-Farber Cancer Institute.
Sure. Well, thanks again. So Naomi Lenane at Dana-Farber Cancer Institute. I'll start. I'm a little bit about Dana-Farber, maybe we'll start there. Dana-Farber is both a hospital and a research institution. So we're a little bit of 50-50. We do both patient care and research and are really known for the sort of bench to bedside, which really means that our faculty physicians are learning about the disease and possible treatments in their labs, and they're bringing that care to the patients in the clinics. And, I have a long history with Dana-Farber. I've been there as an employee for 19 years, but actually both of my parents were treated there, one in the late 70s and one in the early 80s. And so when I had that opportunity to come to Dana-Farber 19 years ago as a clinical analyst, I sort of jumped at the chance to do that. Dana-Farber is based in Boston, Massachusetts. I should clarify there. It's mostly in Eastern Massachusetts and also a site in Southern New Hampshire. So, okay. But our main campus or sort of initial campus is Boston, and we've grown from there over the last 15 years or so with locations across Eastern Massachusetts. And as I said, I've been there 19 years. I've been the CIO since 2017, held quite a few different roles at Dana-Farber, and I've just been thrilled to have the majority of my career be dedicated to the care and treatment of cancer.
Yeah, what an important cause. How is it different as CIO at a cancer institute versus maybe some of the other healthcare organizations out there?
Sure. So it sounds like it could be really different, but I laugh that many of the core challenges are the same. If you think instead of orthopedics and cardiology fighting for your time, budget, resources, you have breast oncology and thoracic oncology fighting for your time, budget, and resources.
But it's still fighting. Okay.
So you just have a different, group of people, but we are all sort of working towards the same. There is a nice, focus, obviously, on, treatment and care of patients with cancer. So there is that singular mission. So you do work at such a mission-driven organization, especially with the research piece of it, that I do think that might be a little different than some, sort of general hospitals. But we're all in healthcare, so we all want to take care of people and make the world sort of a healthier, better place. And I will say maybe too that we do get to focus a lot of our software solutions. Sometimes we're really focused on oncology, which I think was maybe challenging 20 years ago. The market's very different today, but whereas in other healthcare organizations, you maybe have a slew of vendors to choose from. We did a lot of in-house development early on in order to sort of fill the need of oncology specific, but that's definitely changing as we move into more of a digital age here in healthcare IT.
And do you think that's changed because the solutions are better equipped to solve some of the cancer problems, or, that is a big change. I mean, it's happened in every healthcare organization, I think to some extent, but it seems like cancer, if anywhere, might be one place where you could say, yeah, we do have unique needs. We should continue doing this, or is it just not worth it?
So I do think it's worth it to have unique solutions, but part of the full continuum. So I think, the vendors, I think, have just learned from the last 20 years of trying to solve, problems for everyone else and for just sort of taking care of patients and EHRs. They've really learned how to, think about subspecialty care like oncology in the context of the greater care of a patient, and have done a better job at sort of figuring out how to add in some of those oncology specific requirements or needs into, say, a core EHR, but also acknowledging where oncology does need to be different and special and unique, and use sort of a best of breed, plug in or tie in to a core EHR is another conversation that's really changed over the years. And I think, cancer, impacts a lot of people. So there's just as the tech industry has boomed, and especially focused in healthcare, and biotech and all these other industries, cancer is a focus area. So we've seen more and more vendors, come into the cancer world and want to try and solve our problems, which, has been a good thing for us, right? We need help. We want people focused on cancer. We want to partner with people and figure out how to take care of our patients, and how to, cure them or at least treat them so that they can continue on with, healthy lives.
Yeah, it seems like one of the other things I've seen is research organizations often want to retain every single piece of data because that might help my research one day. Whereas an urban hospital, they're like, I want to get rid of this data as quickly as possible because I don't want liability for that piece of data. Have you run into that kind of situation and had to navigate?
Yeah, we do. I mean, there is such, research is so important to us and data is so important to research. We obviously have to, be really thoughtful about what a patient consented to and what we can do with their information based on that consent. But we do use data quite significantly to not just, try and figure out how to treat you better and differently, but also how we can improve operations. I mean, cancer treatment can be, many hours for some patients, lots of appointments. And so not just how to clinically treat you better, but operationally, how can we have a better experience for our patients? And so we've looked to use data for that as well.
Yeah. I was thinking about it the other day. I was like, I mean, I don't know why, this is probably morbid of me, but I thought what if I came down with cancer right now? How would my life change? Right. And I mean, because it is so life changing, I think you have such a big impact on people. That's great that you're focused on that patient experience. So interesting. Well, you talked about, you'd been at Dana-Farber for a while, but I, dug into the archives and I saw that you actually started your early career as a marketing rep at MEDITECH, which, Boston, that makes sense, right? But as you look at that, in this, your history with, that was early health IT days, right? We're even calling it an EMR, when you started, but it's because MEDITECH's been around 50 years, but what are some of the lessons maybe you learned at that early, job at an EHR vendor, that you kind of bring to your position as CIO now?
Sure. I mean, I do credit them for, hiring a, young person and sort of giving them the opportunities that they do, sort of throwing you out there. I did work at a hospital prior to MEDITECH, so I actually had used MEDITECH in a hospital. That was my high school and college part-time job. So, they were happy to have someone who actually had used the software. And I was excited that my part-time job was, helping me get a career. But I do think that, being in marketing, which was sort of my last job at MEDITECH, I had a couple roles there, but was really, I learned to tell people something, tell them again, and maybe one more time for good measure, sort of as you work through a conversation. And I think as a healthcare IT person, working with clinicians, especially, realizing sort of that the lingo you're using or how you're describing something is not always making sense to them, or it's not always as clear, that if you sort of figure out how to say it maybe say it again slightly differently, and maybe a third time. In marketing, that's how it works. And I think it's also helped me in my career to think about how to explain something to people, how to ask the right questions, all of those things that work when you're trying to sell somebody something, helped me, I think, be a better analyst when I got into the role at Dana-Farber.
Yeah. It's amazing how much marketing and sales is part of like every career, whether you're marketing your project or you're marketing your approach, or whether you're, your strategy, your vision, whatever it might be, that, you need that marketing. That's a good tip right there.
Yeah, well, thanks. We actually talk about now as CIO, how do I brand or market my department? So, IT can sometimes have get a bad rap. The hardware's slow, or, something doesn't work. Yet we find many times that people love the people they work with. So, we want to work with this technician, or this analyst is fantastic. So how do we make sure that sort of feeling is, comes out when you're talking about the whole department, and not just that one person that you like to work with? So I haven't solved that problem yet, but that's one of the items on my list, one of my goals.
Yeah, here's a marketing tip. Dan Heath calls it peak experience, right? And he describes the Disney experience. You go and wait in long lines, and it's expensive food, and the food isn't that good. And you're like, wait, that sounds like a terrible experience. Why does everyone pay exorbitant amount of money to go to Disney? And he said it's because you have all these bad experiences, and then you have that ride, or you have your kids see the princess, right, and have a peak experience. And we only remember those peak experiences. I'm trying to think how to apply that to IT. Right. It's like, how could an IT department create a peak experience for their users? That's interesting, right?
Something to think about.
So a lot's changed, right, since you began. What do you think the biggest change has been in technology since you first started at MEDITECH, or even first started at Dana-Farber?
Sure. So I was thinking about this the other day, that we were daisy chaining computers for training when I was at MEDITECH back in the day, and I started as an implementation person, and we sort of would hook them all together. So a lot has changed for sure over the last couple decades since I was at MEDITECH. But I think the one that I think about the most, and we've sort of touched on it a little bit already with patient experience, but is the role of the patient in their care and in technology. So, 25 years ago at MEDITECH, we were focused on inter-hospital operations, lab, talking to the nurse, and pharmacy and doctor's orders, and tying all of those things together. And sort of the, boom of EHRs is all about hospital operations, and sort of making your hospital work more efficiently, but also most importantly, more safely, introducing patient safety into all, as a technology tool. And then became the, patient portals, but also now things like texting patients or telehealth or other tools at the patient's fingertips to make them part of the care team, that they're a member of their care team to help take care of themselves, and to make their, especially in cancer care, really be part of the treatment. What you do, what you eat, how much exercise you get, all of those things are critical to potentially part of how you will recover or how you'll, respond to treatment. And so for Dana-Farber and for me, I really think about the role of the patient and what technologies we've thought about, what we've brought in, what we're hoping to do in the future, and how is the patient at the center of all of that. And I do think that's a significant change, and probably not what I would have predicted, back 25 years ago. I think we all thought it was all going to be, physician systems and making their lives easier. And that has been a major focus. But I did not predict, but I'm really thrilled to see that the role of the patient and sort of the tools that we give them are now a real focus area, not just for Dana-Farber, but for sort of the industry.
Yeah, I'm glad you said that because it annoys me every time when people are like, why isn't the EMR engaged patients better? And I go back, I'm like, do you know the history? That wasn't why people bought it, right? I mean, the customers didn't say, I want to engage my patient. They said, I want to improve communication between the lab or, whatever it might be. So it's such a good, important perspective because now we're playing catch up in some ways. I mean, maybe that was a mistake, right? But it is what it is, right? And remembering that history is important. I mean, just to give us some perspective, like what are some of the top projects you're working on? What's the top 3 projects maybe that you're focused on right now? And what are the kind of the challenges you face in the projects you're working on?
Sure. So there's so much going on, and obviously COVID
Yeah.
has played a
There's a
huge
COVID
role.
project.
Well, and it's sort of the like lingering over here that we
Of
might have to
course.
stop, what do we have
Yeah.
to stop or pivot periodically to sort of address things. And so obviously telehealth was huge in the last year and a half and continues to be work that we're doing, but we are actually also trying to really focus on employee experience. So as
Okay.
much as patient experience and thinking about projects to help, the patient experience, operational redesign or things, we also are spending a lot of time over the next year to say 3 years plus on employee experience. We're doing some work with on workforce management, online scheduling and other tools, really hoping to improve the employee experience. We
Interesting.
are actually also doing some work, a joint project with our communications department on a content management solution that we're hoping to really be the sort of foundation for some digital transformation that ultimately will be about the patient experience and sort of tying our web presence, with these tools like a patient portal, so it's seamless to the patient. I'm not sure we've done a great job historically sort of tying all of these departments together that work in silos, communications doing websites and IT over here doing patient experience applications. Well, those two things should really come together.
I was gonna
And the
say, I
new
can't believe you
patient,
actually talked to your communications person. This is groundbreaking work right here. Like,
well, I'm also responsible for philanthropy. So just think I'm tying all 3 of those things together is my goal in
interesting.
the next, say, 3 years to really have a unified experience for that patient. So that if you go to our website, you're not then directed to sort of this whole other set of tools and things that look so different to actually become a patient, that it really should be, they say digital front door, but I think that's the right way to think about it and to collaborate with these other departments and not be siloed. So that's, a multi-year project that I'm definitely working on. So I think, from my perspective, it really is the employee piece and focusing on that, which, as I said, we're doing some workforce management. We're also looking to do an ERP project. And so that's all
In
about
your free
human
time.
resources and
That's a
those
big one.
things. It's going to be big, supply chain, but all those things that as an employee, are the things that drive you crazy about your job, right? So how do we make that experience better for people? And with, hashtag the great resignation, focusing
Yeah,
on our
that's
employees
true.
is important right
Yeah.
now, and should be always critical, but, especially now. And then focusing on our patients. And I do think this content management solution, which is really foundational and sort of doesn't sound super exciting, except when you think about what it can be, where you can grow from sort of a platform like that.
Yeah. And it matters to the patient who hits your website and is lost and they're already lost in their cancer journey, right? I mean,
Right.
that makes a
Yeah,
lot of
and
sense to focus there.
we want their patient education to be available, and we don't want it to just be some big search and they don't really know what it is. How can we know who you are or somehow personalize your web experience? I mean, those are the things that we would love to see a collaboration between my department and communications really look like.
Awesome. It's great
But
that you're doing that.
I'll let you know when it's there.
That's awesome.
Again,
We'll have you
goals.
to our HIPMIC healthcare marketing community, and
Yeah.
we'll illustrate your example. That's awesome. So as a CIO, what do you think the key is of being a good CIO leader?
Sure. So for me personally, it's all about my people. And partly, obviously, I grew up at Dana-Farber is what I like to
Uh-huh.
say. So, you know, maybe 60% of my staff are people that I've worked with
Yeah,
for 15 plus years.
they're your
Um,
friends.
so they
Interesting.
were friends, they were colleagues, and now I'm their leader. And so I know that they do all the work, right? Like I know that I could not do most of their jobs.
Uh-huh.
I need them to be confident in themselves. I need them to know know their efforts. I need know their work. I need strong work ethic, all that. They're dedicated to the mission. So it's all about the people for me personally. So I think that's critical in a CIO role, because you can say and present whatever you want at the executive level, but as we talked about branding or marketing in your IT departments, all about the experience that they have with the technician fixing, their computer, or the analyst who's, writing a spec. I mean, that's who people deal with. And so that's what's critical to be successful. So I would focus on I try and focus on my people. And I think that for me would be key for any leader, period, but definitely in the CIO role as well, because I don't believe in technology for technology's sake.
Yeah.
My husband probably had to get me off my BlackBerry to an iPhone. I was so
Sure.
I'm not a techie, I'm not a gadget person. It's really about the people using the technology is what's important. Sort of technology that's not used well was not a good investment. So your people and your users are really what will make you successful.
Yeah, that's great advice. So as you look at your career, what's the best piece of advice you've gotten that maybe you could share with other CIOs or possibly even some aspiring CIOs?
Sure. Um, so I do think, we talked a little bit about, talking to people in their language, minimize the whole techie talk, I
Hmm.
guess. But I would also say, probably some of the best advice I got was to own your career. Really think about where you want to go and what you want to do. Because no one's going to tap you on the shoulder and say, hey, you look like a great CIO candidate. Why don't you come do this? And so, we laugh, but I probably, 10 years ago, maybe 12 years ago, the CIO at the time at Dana-Farber and I had a conversation, and he said, what are you thinking for your career? And I said, I want to be the CIO at Dana-Farber Cancer Institute.
Wow.
So when are you retiring? And he laughed and said,
Uh-huh.
well, wait a minute, let me think about that. But, we had that conversation. I wanted to
That's
know, what
awesome.
did he think it would take for me to get there? And so I think you should own your career, think about what you want to do, and have those conversations.
And what did he support you in that, or did you have to, like talk about that? Because I think that that's impressive. I think many people are afraid to do stuff like that. Was that powering, and then he empowered you and you were lucky in that regard in some ways, or did you do other things that helped make you successful?
Sure. Good question. I mean, I will say he was really supportive. Maybe not day one. I think I
Yeah,
took
yeah.
him, I took
You
him a little
shocked
by
him the first day.
surprise. Yeah, I think he was surprised. But ultimately we continued the conversation. So it was something that we kept talking about. He asked good questions like, why do you think you want this job? What do you think that I do that you want to do? So
Uh-huh.
understanding what the role is and what the work is was critical for me. As well. So it was empowering for me to sort of say it out loud, because I
Yeah.
think I sort of said it out loud, trying to see what his reaction would be, that if he would agree with me or
Uh-huh.
not. But it's something that you really need to take some risks. I'm not a huge risk taker. I'm not. buying Bitcoin or anything
Sure.
at this point, but for me, it really was that conversation. So, and he did support me. I would say he, was thoughtful about what he thought some of my challenges were sort of, weaknesses. Where did I have to work? What giving me opportunities to be successful. So definitely gave me project opportunities to show that I could sort of, work on a larger project or, interact with leaders. So I do think as a leader, that's something I remember and think about. Who are you offering opportunities to be part of a conversation or to listen in on a meeting or to do a presentation so they have exposure to senior leadership? He definitely did all of that for me, which was really helpful and made others, I think, comfortable when the time came to see me as a candidate and really see that I could make that transition and sort of move into the role and not say, well, who is that? We've never seen her before. I definitely was at the table and he sort of gave me those opportunities.
There's a powerful lesson there, I think, right? Around, helping people to understand their capabilities and giving them opportunities to be visible in the organization. You were brave enough to say something. I think there's a lot of people that aren't brave enough to say something, and maybe you inspire some of those people to be a little braver and and go out on that limb, right? I think that's a powerful lesson. I appreciate you sharing that.
Sure. No, I would say if you're not ready to say, I want your job, ask, what is your job? Like, what do you do every day? What is it like? Can I shadow you with that? Can I go to some meetings with you? I'm just curious sort of what it's like in your role. I think people are willing usually to do that. It's flattering, right? If somebody says like, I want to do what you do, you're like, okay, that means what I do sounds kind of cool. So you could start there. It's maybe a little less risky.
Yeah. Well, that's a soft way to say I'm interested in it and I have some aspirations without having to say, I want to take your job. So that's
Right.
Great advice.
Yeah. You don't have to say, when are you retiring? And I'm not sure I want somebody to say that to me just yet. I'm not quite ready. So
you're going to send this out to all your staff so that they know. I'm here for a bit. It's interesting. I mean, I actually always wanted to be a CIO. I always thought that's what I wanted to aspire to be. And I learned what they did, and I learned I was wrong. I didn't want to be a CIO. So, I mean, I think there's value even there, right? To understand some of those things. And maybe, some will find like, oh yeah, this is what I love. I love to, deal with people and I love to put vision, and I learned I didn't want to manage people. And so I was like, no, I don't want to be CIO. And so, that's a valuable lesson. I appreciate you sharing that.
Sure. No, I do think it's critical for people to figure out, do you want to manage people or do you want to be an individual contributor? And I did both over the last 19 years because being a leader is as I said, it's all about the people. It really isn't about sort of you and what you're doing and sort of some separateness. It really is about, standing up for what your team is delivering, because you're not doing it. They're doing all the work and you're just, the checking the budgets and sort of keeping all the lights on for them and, supporting them by being sort of a person at the table in these executive meetings, but really they do all the work. So if you're not interested in watching your team grow and seeing other people succeed, if you are someone who needs to do all the tasks yourself, like being a leader might not be the right job for you.
Yeah. Well, Naomi, this was a lot of fun. I appreciate you taking the time and for sharing your insights and perspectives. I'm sure we'll have to have you back again, but thanks everyone for watching. If you want to find all the rest of the episodes in the CIO podcast, you can check them out at healthcareittoday.com. Thanks, Naomi.
Great. Thanks so much for having me. It was a good time.